At DeKalb we started this because we wanted something better for healthcare. We wanted people to actually have an enjoyable visit when they go to the doctor, not postpone it, not put it off.
They care about our folks. They care about our folks as individuals. They spend time with our folks. They have caught a few things that a lot of individuals would not necessarily have known about until things got too far along.
DeKalb is different than traditional care in a couple of ways. Healthcare has a couple of problems in America. One is the access to care and the cost of care for individuals and their families. DeKalb really attacks those two problems at the same time. By making the cost very low or nothing for employees, it takes away the cost of care barrier. And the access to care is solved by having your doctor's cell phone number, having same day or next day access to the clinics, and an unlimited amount of consultations with the doctors.
DeKalb has provided our employees with 24/7 health care. We can call their office during business hours, after hours, text them. They've handed out their cell phone numbers.
From a financial standpoint, DeKalb gives employers a way to save money on their total health care spend by buying less insurance from the insurance company and bringing in the direct primary care model to fill in those gaps in coverage.
Well, DeKalb has been different from traditional care in one significant way. A lot of our employees are teachers. They are scheduled all day. They've got families. They are just running so scheduled and so busy. But they can get into the doctor so quickly, even during a free period in the middle of their day. Just a few miles down the road and able to get in for a quick visit. That's been a real difference for them.
As a business, we wanted to provide DeKalb as a benefit because we were able to offer a high deductible plan to our employees. It was something that we were very happy that we were able to do, but as a high deductible plan, it really left a lot of people not going to the doctor often. They were having to pay all of that out of their pocket, and we just found that people were not using the availability of doctors as much as we thought they probably should or could. So when we found out about DeKalb, a very reasonably priced option that gave people the option and ability to go to the doctor much more frequently, we just thought this was a tremendous benefit to be able to provide to our employees.
The ability to text or to call and to get feedback within just a few minutes. Just today I picked up a prescription for blood pressure medication and realized I was running low, sent a text, and literally within 5 minutes it's ready for me. It's just a matter of picking it up.
My favorite thing about DeKalb is that they were able to see me in a very timely fashion. They were interested in all of the small details. They were very personal. They asked me about my family, about my daughters, about my wife, about how long I've been at Boyd. They seemed just really genuinely interested in me as a person.
From a business aspect, we like DeKalb because it's going to help manage our cost and it's going to put money back into the teammates' pockets from the bottom line.
You know, the way the traditional market works for insurance is I go to get care and I find out after they have filed it with my insurance what that visit's actually going to cost me. You know, assuming I don't have a easy copay or something like that in my plan. You know, a lot of plans today are what called qualified high deductible health plans, therefore they don't have copays with them. So when I go for a visit, I don't find out till after that visit what it actually cost me. So unfortunately, there's really nothing else in our society that works that way. You know, before we go buy groceries, before we go buy a car, you know, we're able to shop and figure out what that's going to cost. But in healthcare, it's a little bit backwards in that regard. So I think one of the main benefit of DeKalb, of working with DeKalb, is that employer or that employee, whoever's paying that cost for that, they know on the front end, this is what I'm paying a month, and this is what I get for what I'm paying.
In America, we know that healthcare is unsustainable. By 2033, 100% of household incomes will go towards healthcare premiums if something does not change. Now, we know something has to change. That's the reason we're changing it now. We want to be the leader in healthcare innovation. We want to set the goals, set the standards, because right now the standards are very low. A patient who usually would not see the doctor, now they'll be seeing the doctor because now they don't mind calling, texting. They trust the doctor again because, again, we have no incentive to prescribe more medicines, prescribe anything that would not be quality of care for the patient.